Hello, my name is Dr. Keith Giaquinto, and I'm an Internal Health Chiropractor. In this video, I'm going to be introducing my brand new health educational series called Body Talks. And a big part of why I'm doing this is because I've been in private practice since 2002, and I've worked with thousands of people over the years. And I take much more of a holistic and functional medicine approach in treating my patients and helping them to get well. And what I have noticed is that there are certain commonalities that bring people into my office with health challenges. And some of those commonalities is things like the way people think about their health, what they're taught or not taught on how to take care of themselves, and the habits that they have created that have led to their health issues that then brings them into my office. So a big part of my customized care plan for each patient is the educational component, teaching them how the body works. What is that first domino that triggers their health issues? And what can they do at home to strengthen their body and support normal function so that they can get back to engaging and living up to their fullest potential? And that is what has led me to this video series. And I'm really excited about sharing this with you and bringing all of that information to you. So in this video, what we're going to be discussing is that we're going to be talking about what my why and my intentions are for Body Talks. We're talking about that pathological model of disease, and then what my vision is for Body Talks. So why am I creating Body Talks? Well, the first reason is that if you like to learn the truth about health and healing and how the body works, I like to teach. So I'm taking all of my chiropractic schooling, all of my post-grad work, all of my continuing ed work, and my clinical experience, and bringing that to you through this series. So if you like to learn, I like to teach. This is fun and exciting for me. The second reason is the owner's manual. We have to think of our body as like a high-performance machine. And just like any type of machinery, who really walks us through that owner's manual of how to operate this piece of machinery so that we can get the best performance from it? Well, that's part of the reason as to why I'm doing this, is to help teach you and walk you through that owner's manual. Because whether you realize this or not, well-being is our natural state. Inside our body and inside every single cell, there is this innate intelligence, this desire, this will to live. And every single cell knows exactly what to do to grow, repair, heal, and to maintain homeostasis without conscious thought. The problem is that we abuse our bodies to a point that it can no longer compensate, and it has to break down, and it has to give us symptoms and health issues. So that's part of this, is walking you through that owner's manual. And when you can do that and apply some of this stuff into your life, then you can live up to your fullest potential. Because if we can start putting more conscious thought and effort into building healthier habits to support normal function and strengthen our bodies on a daily basis, well, then we can come from a place of strength and peace and joy. And when we can come from that place, then we can become better spouses. We can become better parents, better siblings, better friends and citizens in our community. And that's really what this is about. That's the bigger picture here. So what is my intention for Body Talks? Well, the first thing is to help you guys to understand bigger concepts about health and how the body works. Because anything can cause anything in the body. And what are some of these bigger concepts that we're talking about? Well, it's learning how to trust homeostasis and this innate intelligence, which is what makes my job as a chiropractor so easy, because homeostasis and innate intelligence are always on the job. They always do their job. They always do it correctly. We just need to support the body in such a way that they can then do their job. So understanding what homeostasis and innate intelligence really is, and I'll be doing separate videos on each of those in the future. But then also taking a deeper dive in understanding the individual pieces that make up the bigger concepts of health. Because what happens is that health problems and challenges don't happen for a reason. There's a specific cause and effect relationship that happens, and there is something that triggers that first domino to fall over, which then has this whole cascade of events that leads down the road to symptoms and health issues. So we're going to take a deeper dive in understanding the individual pieces that make that up. So then once you can understand these concepts and the individual pieces, this will give you the confidence to fully own your health. Because health is just like happiness. Nobody can make you happy except you. Happiness is an inside job, and so is health. Because once you can live with confidence and fully own your health, this is where you can become better informed. You can make better decisions and create healthier habits and live up to your potential. Body Talks is not intended to diagnose or treat any medical condition. It doesn't replace conversations about medical conditions between you and your healthcare provider. What it is intended to do is to give you a deeper understanding of the truth about how the body works so that you can have a more intelligent conversation with your healthcare provider. Because again, it comes back to being better informed means that you can make better decisions regarding your health for you and hopefully creating healthier habits along the way. I want to talk to you about this pathological model of health. The way that I was taught in chiropractic school is the exact same way that medical doctors are taught in medical school, where we have this spectrum of health, where on one end of the spectrum the body is healthy, and on the other end the body is diseased, black or white. There is no gray area in this model. But what happens is that as your body comes away from health towards this disease process, there are certain things that happen along the way. And what's the first thing that happens to occur? Well, there's a certain level of dysfunction that's going to occur in your body. And how is your body going to let you know? Well, it's going to give you a certain set of symptoms. And then the closer to the disease process that your body becomes, where there's actually damage and destruction, this is where your diagnostic tests are going to become positive. But what I want you guys to understand is that there is one condition that triggers this whole cascade of events, that first domino, if you will, that falls over. And that one condition is stress. And we're going to be doing a deeper dive in unpacking stress and what exactly I mean by stress in later videos. But this is what Body Talks is going to be focusing on, is this whole what we can do in this area. Because from this level of dysfunction and before diagnostic tests become positive, this is what I like to call the walking wounded. This is the area of functional medicine. Things that you can monitor and measure along the way to let your body know that, hey, you're moving in that direction. Because when we're talking about diagnostic tests, what are we talking about? This is blood work, urinalysis, ultrasounds, MRIs, CT scans, x-rays. And what is the purpose of these diagnostic tests? Their purpose is to determine how much damage, destruction, or degeneration is occurring in a particular organ system or in a tissue in the body. But how common is it that people that have a certain set of symptoms, that they go into their medical doctor, say, hey, I got X, Y, and Z. Your doctor runs these litany of diagnostic tests, and all of these diagnostic tests come back negative. It is very common. So then your medical doctor's like, well, we don't know what's causing this, so here's medication that deals with the symptoms. And a lot of times these patients end up in my office looking to help restore normal function so that we can prevent these diagnostic tests from becoming positive. So let me give you an example, right? Let's talk about diabetes. Diabetes, you measure it two ways. Fasting glucose, which has to be below 100, and then you have your hemoglobin A1C, which anything below 5.6 is normal. Anything above 6.5 is you're a full-blown diabetic. So let's just say you go in for your annual physical, your doctor runs his blood work, and your fasting glucose comes back and it's like 105. And your A1C is starting to creep up and it's like, 5.9. So you're not a full-blown diabetic yet, but you're on your way. Your body's starting to give you symptoms. Well, they can't give you medication until you have become a full-blown diabetic. They have to wait for the damage to be done in order to prescribe that. So that's what I'm talking about with this pathological model of health. My mentor, Dr. Howard Loomis, in his book, Enzymes, the Key to Health, he states that, unfortunately, a vast majority of us have a disease or degenerative process in our future. It is an 18-wheeler coming down the highway right at you. You would like someone to warn you of impending danger so that you can move out of the way. Unfortunately, diagnostic procedures don't do that. They can only measure the damage after the truck has hit you. And this is a very big reason as to why I am introducing this series, Body Talks, is because your body speaks to you and it talks to you along this way to let you know that things are not functioning properly. And I'm going to be coming from an approach and a perspective of what the developer of chiropractor stated way back in the early 1900s. B.J. Palmer, he stated that the power that made the body heals the body. It happens no other way. Because the body is designed to heal itself. Why not help it along the way rather than hinder it? Because this is what we are simply not taught. And this is going to be the premise and the perspective of which Body Talks is going to be coming from. So what is my message? Well, it first has to start with responsibility and accountability. In order to own your health, you have to be willing to take 100% responsibility for that. If you are depending on an outside thing or somebody else to make you healthy, it just doesn't work that way. So accountability and responsibility is the first thing that needs to happen. The second thing is that we need to learn how to trust homeostasis and innate intelligence, which I will be doing a deeper dive and unpacking each of those in upcoming videos so that you can understand the bigger picture of how the body really works. Creating healthier habits along the way so that we can support normal function and help it so that we can get the best performance from our body rather than hindering it. Because again, if you like to learn, I like to teach. Next episode, we're going to be talking about mindset. Offensive health, defensive health. What's the difference between the two? If there's a specific topic that you want me to talk about, please comment down below. And also too, if you learned something from this video or you just something shifted for you, please also comment that down below so that other people can read that as well and we can get a conversation going on. I greatly appreciate that feedback. So thank you for watching. If you thought the content of this video was good, please give it a thumbs up or like it so it'll let other people know that the content was good. Also, if you want to get notifications of future videos, please subscribe to my channel. And then lastly, and perhaps more importantly, is that if this content really resonated with you and somebody else needs to hear this, please share this video with other people so that we can get other people engaged in this conversation and that we can pay it forward. I greatly appreciate that. So until next video, I'm Dr. Keith. See you next time.